Hello everybody, thank you for tuning in again. I'm Dr. Elemile. I really appreciate you tuning in again today. Today I'll be discussing something very important. I'm going to be discussing how patients can improve their doctor encounter satisfaction when they visit a hospital. We all know that healthcare delivery in this part of the world is very challenging, and there's so many factors involved. The list is endless. However, there are things patients can do for themselves that would help them to enjoy a better encounter with their doctors. Now, when a patient visits a hospital for the first time, they're given a hospital card in places where electronic medical record is not available. Now, that hospital card contains their patient identification number, which will be used to retrieve the case files during subsequent visits. I've realized that many people do not keep these cards or do not remember their patient identification number that will be used to retrieve their case files. Retrieving a case file for a doctor to see or to preview before seeing a patient is very important and can go a long way in delivering a better care to a patient, because previous information of the patient is already in the file, which a doctor can have access to, as against opening a new file for a patient and then starting to ask past medical history all over again. So it's very important that patients keep these files. It wouldn't be a problem in places in hospitals where they have electronic medical record where everything is digitalized, which should be the standard everywhere. But we should make do with what we have now until we get to that level. So keep your hospital card or memorize your patient identification number. It's going to be useful to help to retrieving your case file in the hospital. Secondly, I've realized that many people move from one hospital to the other, move from one medical professional to the other, seeking opinion here and there. There's an adage that says too many cook spoils a broth. At the end of the day, they get confused. They don't have a valid information, and at the end of the day, they are very confused. Now, it's better to stick to a good hospital and ask your doctor questions. And that's why family medicine, really, you having a family doctor that you can have a relationship with is very key. Now, this family doctor can help you to have access to other specialists through the family. So the family physician serves as a middleman between you and specialists. So it's very important that we don't go about shopping for healthcare professionals from one place to the other. Especially for elderly patients, it is dangerous for them, because they give them drugs here, they give them drug here, another drug there. They say something here. A doctor has this opinion, the other has another opinion. At the end of the day, the patient is confused. Now, still on the point of moving from one hospital to the other, if because of the level of satisfaction you're getting in a hospital, you want to move voluntarily from one hospital to the next, it is usually good to have a written letter from or what we call a referral from where you're coming from to where you're going. It's going to help the other doctor to provide a better care and not duplicate care for you. I've realized in my practice that people move in the process of moving from one facility to the other, they don't have an idea of what they are being treated for. They don't have an idea of the diagnosis, and they do not have a referral. Now you're starting all over again. Probably the investigations you are done before, you're doing them again. But if you had a referral from where you were coming from to a new place, it makes it easy for you. It's easier for you. It's easy for the doctor to look through the referral notes, see what was being treated at the point they've reached, and where he or she is to start from. You can agree with me that having that referral is very key. Now, going to the third point, in my practice, I've realized that many patients come to the hospital without even knowing how to express themselves. They don't have words to communicate how they are feeling. Now, you ask them, ma, sir, after establishing a rapport, after you've introduced yourself, after you've greeted them, so what brings you to the hospital? So you hear responses like, I don't even know. I'm just sick. And in the Nigerian way, you say, I'm feeling strong. I am strong. How do you want a doctor to clack around, I am feeling strong? Now, the way to go about removing that kind of problem is to, before you go to visit your doctor, think about the things you want to discuss with your doctor. Have a list. You could have a list of the things you want to discuss with your doctor before you go to see your doctor, so that nothing is going to be missing. There are ways, there are skills a doctor can use to retrieve information from a patient. But you know, there are different levels of skill, and you don't know who you may not meet a doctor who has such a skill to get all the information from you. But if you come prepared with your list of complaints or list of concerns, it makes the work of the doctor easy. You get a better care, a more satisfying care from the doctor. Now, let me give you an example. There are times when during my residency program that you see a patient, you see a patient, they lay their complaints, and you've clacked around all the complaints, you've asked all the questions, you've even done a physical examination, and then you've written your assessment and then your plan. And the patient says, excuse me, I have another complaint. And you're wondering, please, I'm already finishing my notes. Where is the complaint coming from? And the patient tells you that, well, I forgot to mention it, or the fact that I felt that this complaint is different from the other complaint. That was why I didn't mention. I wanted you to deal with this complaint first before moving to the next. It doesn't work that way. So write all your complaints down, or think about all your complaints and give them all to your doctor. Now, well, there's a doctor side to this point. There's a way a doctor can ensure that all the patient's concerns are addressed, but it's not for discussion today. I'm focused on what patients can do for themselves. Now, usually, one thing I've also realized in my practice is that so many people, especially educated patients, come to the hospital already defensive. Maybe because they've had the notion that doctors are these, healthcare providers are that, and all that. So they are coming already defensive. Now, come on, let's let loose. This is someone who is going to be to care for you based on the knowledge he or she has. And it really is supposed to be like a relationship. And that's why I love family medicine so much, because what we emphasize is doctor-patient relationship. We are moved from doctor-centered care type of care. We are practicing patient-centeredness, in which it's all about the patient at the end of the day. Even though the doctor feels that or as what he or she wants to do, but because of other factors surrounding the patient, the doctor can shift ground. Patients also can shift ground and reach a common ground in the care of the patient, because at the end of the day, it's all about the patient anyway. So please don't go visiting your doctor already defensive. Have an open mind. Doctors are not all the same. The fact that you had a bad experience with a doctor yesterday doesn't mean you are going to have a bad experience with another doctor today. So go to the hospital with an open mind. And also, one other problem I've identified with many patients is patients coming already making their own diagnosis. And for example, what's wrong with you, ma? What's your complaint today? Why have you come to the hospital to see a doctor today? And the patient says, I have, the commonest one is, I have malaria and typhoid fever. And you say, God. Now, when a doctor poses this question to you, that, okay, why, or what are your complaints? You're just supposed to tell the doctor how you feel, the things that you're experiencing in your body. For example, is it a headache you have? Are you having a poor vision? Are you feeling weak in your body? Are you having body pains? Are you having abdominal pain? That is what you should say, not telling the doctor that I have typhoid fever. And you know, some people would actually insist that it's typhoid fever that they have, and that's what must be treated. You know, there are ways doctors too can go about patients who are like this. But for today, you know, as I said earlier, we are focusing on the patient right now. So please don't go to the hospital making your perceived diagnosis your complaints. Just tell the doctor how you feel, and together you can work to reach a conclusion of what the diagnosis or what the assessment may be, and plan. Also, call some set of patients Google scholars Google scholar patients, in that they have googled all their symptoms and all that. But it's the same thing I'm going to say. Just go with an open mind. You should know about your body. You should read about what you possibly have, but you should also have an open mind to listen to what your healthcare provider has to say, and together you can reach a conclusion. Also, there's some on the extreme end, you find some patients who are not even, they don't know what they are being treated for. Today, if you do not know it, you have the right to know what you are being treated for. You have the right to know why, what investigation, if you were given an investigation to do, why that investigation is to be done, why the drugs you were given by a doctor was prescribed. You have a right to know. It is your body, and you should be concerned. You know, sometimes you find it appalling when people do not know the drugs that they are taking. I'm not talking about people who are not educated. I'm talking about highly educated people who do not know the names of the drugs that they are taking, or what the names of the or a description. You may not even know the investigation, the name, so to say, or the name of the drugs, but the description of what they are using on themselves. So with all these things that I've said, this is part 1. I'm going to bring out a part 2 of how patients can improve their doctor encounter satisfaction, and a part 3 on how doctors can improve patient satisfaction. I started with what patients can do first before doctors part, but it's going to be a series. We're going to be there's going to be a second part on patients, and then we cap it up with what doctors can do to improve the level of satisfaction of patients. I hope this video has been enlightening. So remember the key things: always keep your cards, remember your personal identification number, except there's electronic medical record in your health facility. Stop doing hospital or health professional prostitution. Stop shopping from hospital to hospital. Think about the things you want to discuss with your doctor beforehand. If possible, have a list. Have words to describe what you are feeling in your body. Demand from your doctors what you're being treated for, why, and what drugs you're using. Keep an open mind. Don't be defensive when you go to the hospital, and you'd enjoy a satisfying relationship with your doctor. I hope these tips are going to be helpful to you. God bless you. Enjoy. Mwah.